Andrew Mitchell.
Thank you, Madam Deputy Speaker. In spite of the somewhat churlish approach of the opposition front bench, today's announcement by my honourable friend marks good and steady progress from a government which has actually, after very many years, started to tackle this important problem, and I think the House should give her credit for that. Does she understand that for us in Sutton Coldfield, where we have a more elderly demographic, this matters very much indeed? I want to support what my right honourable friend from Ashford said. We need to see really coherent policies which enable elder folk to stay in their own homes for as long as possible. And in particular, the new agreed and enhanced role in keeping people in their homes of the services emanating from the Royal Sutton Coldfield Cottage Hospital are front and centre of the plans we have for making sure this white paper and the accompanying policy really has an impact in Sutton Coldfield.
I thank my honourable friend, and of course I'm trying not to get too disappointed by the reaction of the honourable members opposite. I didn't really expect an awful lot more, but he's absolutely right. In Sutton Coldfield and in Surrey and in those areas, they're very expensive areas to live as well. And we obviously need to make sure, most people, if you ask any one of us about our future care arrangements, we'd all say we'd like to stay in our own home pretty much. And that's what we want to do, and we want to enable that. Using technology, there's a lot of technology that will help with this, but also adapted, more supported housing and working with local groups to make sure that we deliver the right approach for those right areas, and that will include local hospitals as well.